So, we've heard what it takes. We have a timeline. There is also another piece to all of this, which is infrastructure. Particularly when it comes to digital change, infrastructure is certainly not to be forgotten. Quite the opposite. It is the foundation of all of these change initiatives in many ways. So we're turning to this topic and the role of the cloud in healthcare. How do we do this well? How do we mitigate the risks? How do we take advantage of the opportunities of the cloud? How do we make sure that we manage to really develop the organization alongside these opportunities that open up from these enhanced technical capabilities that we add when we move to the cloud? These and other questions, I'm looking forward to hear about how to go about it from Myriam Fernández Martín, Head of Health Innovation EMEA at Amazon Web Services. Welcome to the stage.
Good morning, everyone. Thank you so much for being this morning here. Thank you so much to the ICT organizing committee for the invite. It is a privilege to be in this conference with so much talent and so many discussions happening. We are going to talk a little bit about now in this journey of Europe digital health momentum that we are living. What does intelligent care, empowered excellence mean where cloud and AI can really amplify the human touch? So how many of you already use artificial intelligence? Okay, let me ask the question the other way around. Is there anyone that doesn't use artificial intelligence? Okay, I don't think I see any hand raised. Okay. So how many of you know or can tell me what do you think is the most intelligent algorithm ever built? Any ideas? No? Okay. Well, guess what? The most intelligent algorithm ever built is the human being. The human being is a dance of DNA, dreams, and emotions. With millions of years of evolution, wisdom, and untold stories. And that makes each of us similar to others, but very unique. And this is not something new to all of us that have worked in healthcare or work in healthcare, to understand that it is not only about a diagnosis, it's not only about a treatment, it's not only about the care that we can provide. It's also about choices, it's also about decisions, it's also about support, it's also about where do I live, it's also about who do I talk to, who do I spend my time with. A lot of components go into how decisions are made in really evolving a system that has to support the fact that all of us that we are here today have something in common, which is, if not already, we are all going to be patients someday. So let's come back to the basics. Most of you know, I'm sure, about the study that was published in the Institute of Medicine in 1999 to Where is Human, where in that study, 3.7% of the hospital admissions was stated that would suffer an adverse event. After that study, many European countries embarked on similar studies that average a percentage around all the way from 7 to 12% of hospital admissions would suffer an adverse event. And this was since 1999. To put this in perspective, this is the equivalent of a Boeing 747 crashing every day and everyone dying. So a little bit more than 25 years after that, still, nearly 1 in 4 patients suffer an adverse event. More than 50% of the patients feel their providers lack compassion when they talk to them, when they go through any process. And 86% of the healthcare errors that occur are administrative or due to administrative reasons. A misdiagnosis is affecting 1 in 20 patients every year. And an average senior patient is seeing 7 different physicians across 4 different specialties. So this is one side. Let's look at the other side as well. The time our clinicians are spending in documentation and administrative tasks is insane. On average, a physician is spending 4 hours daily documenting. Nurses, we spend 2 hours per hour of patient care documenting. A clinician, on average, has to navigate around 12 different applications to find patient data. So how do we bring all of this together in a healthcare transformation that truly brings back to the point what matters, which is the health outcomes? If we look at the patient and the citizen, 40% of the patients use social media to search for health information. 92% of the patients want to access their medical records. And guess what? You're all using AI. Patients as well. 2 out of 3 people use AI for health-related questions. Whether they use it, informed, not informed, with the details that are needed, that's another discussion. But that's the reality that we are facing right now. In addition to that, the healthcare industry is the industry that it is producing the most amount of data compared to any other industry. 30% of the global data is produced by the healthcare industry. But 97% of that data remains unused because it's captured in unstructured formats and therefore not used for clinical decision-making. So we can generate a lot of data. Now, is that data used for its purpose? That's a separate story. The pace of innovation is such that right now it is estimated every 2.5 days, a new generative AI foundation model is released. Okay, so what is the role of the cloud in all of this? Why is it important to consider the infrastructure? Amazon Web Services is the world's largest technology provider, powering a scalable and secure healthcare infrastructure. We have a very unique way to build our infrastructure. We build what we call high availability zones that are composed by 1 or more data centers. And wherever we have 3 availability zones together is where we form a region. Right now, we have 120 high availability zones across 38 geographical regions. This is twice the availability zones and 3 times as many data centers as the next largest cloud provider. We have just announced and launched, end of last year, a 7.8 billion investment in a European sovereign cloud that I'll explain in a minute what it means, and this is in addition to the existing regions that we have in Europe. And on average, we have more than 19 years of healthcare leadership experience among our teams. Me, myself, I'm a PhD nurse with over 20 years of experience in healthcare and technology across different countries and regions, all the way from the US to Europe. Our chief medical officer is an interventional radiologist by background. So we have people that have lived and understand what healthcare means, what are some of the challenges that we are facing, and bring back that voice into how we are approaching different strategies from a healthcare technology transformation. And we are the only cloud that got awarded the CLASA Public Cloud for Healthcare in 2025. So what is the European Sovereign Cloud? So the European Sovereign Cloud, it is really an additional cloud, as I was mentioning before, of 7.8 billion investment that we have launched in a region in Germany. So it's sovereign by design like any other AWS existing regions. So the foundation of the industry-leading infrastructure, so same security, same availability and performance as the rest of the AWS regions. Sovereign by design, same as the rest of the AWS regions, with strongest sovereign controls, broadest and deepest portfolio of services. Now, in addition to that, it has European operational autonomy and resilience. So it's an independent infrastructure operated by AWS employees that are EU residents and located in the EU. And it also gives further choice for data residency in the EU with customer content and customer-created metadata stay inside the region. You have a QR on the top right corner. If you want to learn more about the European Sovereign Cloud, you can scan that QR and it will take you to additional information. There's a lot of information published about this as well. And my colleagues are outside in the AWS booth as well if you have or need any further information. So we are enabling the whole global healthcare ecosystem to really help drive forward the democratization of cloud and artificial intelligence. We work all the way from with regional governments, research entities, insurance, life science companies, health techs, diagnostics, hospital, clinical systems, and national governments. 4 of the top 5 genomic sequencing companies work with AWS. All the top 10 medical devices organizations work with AWS, so Philips, General Electric, ACPAM. 19 of the top 20 life science companies work with AWS infrastructure, and more than 80% of the healthcare unicorns and startups work with AWS. So our role really is helping and enabling the ecosystem to innovate, to ensure that we are using everyone's talent to face and think through opportunities to really respond to the existing healthcare pressures. What makes AWS differently from a generative AI perspective? So let me explain a little bit about this and why this is important. So I'm not a technologist, but as I mentioned before, I'm a clinician by background. Usually, clinicians, we don't tend to think on the technology as something foundational to what we do. It's obviously an additional thing, an additional tool to our daily jobs. However, if we put this in perspective, let's imagine you would like to build a new house. And if you're designing the building of a new house, you will start by thinking, how many floors am I going to build? This is going to be 1 stage, 2 stage? Is it going to be a tower of apartments? Because depending on that, your foundation is going to be different. And if you don't build the right foundation, you might build the first floor, but then if you arrive to the third floor and you don't have the right foundation to sustain it, the building will go down. And that's the way that we need to think on the infrastructure whenever we are approaching any innovation. So the bottom layer on the generative AI stack is the infrastructure to build, train, and run large language models at scale using, for example, multimodal data. So when we think about large language models, we tend to think about models that are based on millions of data points. Now start to combine those data points with multimodal data. And this first layer is oriented mostly for builders that are building those innovations with those foundational models. The middle layer then is what we call the managed Amazon GenAI Suite, Bedrock. And what this allows is via APIs, the access to this large set of large language models. Remember, I was telling you that every day, every 2.5 days, a new large language model gets released. We are seeing that all the time. And the ability to be able to change from one large language model to another is going to be critical because it will not be late that we will start seeing models per specialty, for example. I think some of you might have heard already on ChatGPT Health or Claude Health, right? So whenever I am making a decision or using an innovation, let's say, for example, that helps me analyze CT scans for a certain disease, I want to make sure that data is trained with CT scans and not trained with other things. So the ability to change from one to other is what Bedrock does. And then the last layer is the layer where we have these end-tier applications that really are able to navigate internal systems and help either write code more quickly for those that are building the solutions or navigating across the different entities and different data points. So generative AI needs the cloud to scale. There's absolutely no way you can run these type of elements in a local infrastructure. And we know AI can mean improvements in health outcomes on 30 to 40% and a 50% reduction in patient costs, but that's just the peak of the iceberg. What we don't tend to see is that there are many more considerations that we have to make. The foundation, the technology I was mentioning before, is a critical one, but then the mindset. And this is something that we tend to challenge from a healthcare perspective because we are trained in a do no harm approach. We don't tolerate error at all. And to innovate, you have to be ready to fail because things fail. And you have to think in that manner, what happens if this fails? What should I be doing? And this is a big, big cultural change for healthcare. So this requires also new skills, new abilities, new competencies, and obviously new processes, governance, ethics, alignment. And what is coming? Agentic AI, and agentic AI agents are already happening a lot in the life science arena, starting to happen more in the healthcare arena. Agentic AI are autonomous systems that can act independently to achieve predefined goals. And it's estimated by 2028 that more than 1/3 of the enterprise applications will be powered by Gen AI and agentic AI. So those who act now are shaping responsible and artificial intelligence-enabled healthcare. We heard about the European health data spaces. We heard about the vision, right, that we want to achieve. I use the similarity having with my father, 89 years old person, a conversation the other day where he was asking me, so help me understand why can I go with my credit card to any bank in the world and get access to my account, and I cannot do the same with my health card. And I think this is what we are trying to respond to, is this need of ensuring that the data follows the person and goes with the person wherever they go. But also with the existing understanding on what is that we have today and what do we need to put in place to move forward. So let's watch this brief video. So download this white paper that talks about this concept and think about how can we incorporate that there were some ideas on where to start on this idea of a health data marketplace that brings together an additional layer on top of any infrastructure that you have right now, any one that you will be having, to really go on a self-serve approach, depending on who I am, on the data needs that I have. And this white paper includes examples from a university hospital on designing a platform to provide a shopping cart type of experience for clinicians, researchers, and partners, and from Catalonia's digital health strategy, exemplifying the evolution from fragmented health systems to a true health data marketplace through an open platform. I don't know how many of you are exposed or to the work that is happening in Catalonia regarding the open EHR community. You will see some insights into that also in this white paper, which is really trying to respond to three main pressures, right? Hospital operational excellence and person-centered experiences, the pace of change and innovation in agentic and generative AI, and how to keep up with health regulatory compliance. Okay, some examples on some of this work that is already happening. A unified data platform supporting agencies, care providers, and national initiatives. A lot of work happening in this space. I think one of the most prominent one is the NHS Spine, where the NHS migrated to AWS 44,000 connected healthcare IT systems, 26,000 linked organizations supporting 500,000 health professionals to support 43 million messages sent every day. Or the work happening in a region in Spain called Rioja Pascal. It's a unified data infrastructure that is enabling predictive, participative, preventive, personalized, and precision medicine, so the 5 Ps, of modern healthcare in alignment with the European health data space. The European health data space and the data orchestration and the unified health data platforms are the basics to then really ensure that we are approaching generative AI and agentic AI in the right manner. Without the right data, you are not going to get the right insights. And this is what I call AI for good, which comes back to evolving the mindset to ensure that whatever we are doing is really impacting patient outcomes, health outcomes. So for example, we talked about the NHS, so how the NHS is powering the lung cancer screening at a national scale. With already 1 million people screened, 3,000 cancers detected, 74% caught in early stages, using generative AI through mobile scanning, having 40 NHS hospitals connected, and already seeing a mortality reduction in both male and females. Or the work that HeartFlow is doing in the Max Grundig Clinic in Germany, where they are reducing unnecessary invasive coronary angiographies up to 52% through AI-powered 3D heart models. And the most important part of this is that traditionally this would have taken months, if not years of implementation. And because the Max Grundig Clinic already has all their infrastructure in the AWS cloud, the implementation took just 4 hours. Or across the whole region of Catalonia again, where they are putting at the fingertips of the providers and the clinicians clinical guidelines based on clinical evidence content that has scored 98% of the physician residency exam. And right now, with the target of being used by 20,000 healthcare professionals in 400 primary care centers, extending now to the ED, is already being used by 5,000 physicians with a 92% satisfaction. Or changing the citizen engagement, how do we make sure that we give the patient the voice and the empowerment that they need? 10 of the Finnish healthcare counties are already using citizen engagement platforms, or through enabling triage even before coming to the hospital to see if the hospital is the right resource for that patient, or should they be directed somewhere else. Or enabling an EHDS journey with LLMs and frameworks, ensuring AI safety with 99 accuracy to escalation. Some ideas and quick recommendations. Adapting technology is, again, is an enabler. You're going to find resistance to change, not something new. And it's mostly based on loss of control or position. So recognize the challenges, develop practical competencies and organizational governance. Deliver value. I cannot stretch this enough. If we are not able to measure the success of anything that we are doing, it will not work. We need to ensure that we are delivering value for our patients, for our clinicians, for our communities. Use technology as your ally. It's not the enemy. You can really understand that foundation that you are building and build a proof of concept. Try. That's also something that the cloud allows, the speed of innovation. You can try a proof of concept in 2-3 weeks, and if it doesn't work, then you don't roll it out. Culture, processes, technology, and clear results. Okay, conclusions very quickly. Every patient is an algorithm of DNA, dreams, and a story. There's a unique life story behind each diagnosis. Cloud and AI are acting as care team members, helping detect patterns, prevent errors, and personalize treatments. We need to give them the right competencies and define the role. Technology that serves humans, that honors billions of years of evolution, with a goal of more attentive, precise, compassionate care, so every health story matters. So if we bring together artificial intelligence to enhance human wisdom, then we will be able to make sure that every life story matters. Thank you.
Thank you so much for these remarks. Give me the clicker. And just one quick question. Today we've had a focus on nursing. You're a nurse yourself. I think it's a wonderful intersection at which you operate between technology and nursing. Why is this so relevant for nurses also to understand?
So I think traditionally we have seen IT projects as a separate thing that was led by the IT department. And when we realized, as I was mentioning before, that technology can be an ally to our work and can really help release some of the burden of the administrative tasks that we are doing and where we are spending a lot of our time that is really not bringing back value to patient care, then the opportunities are endless, right? I always say any innovation has to be clinically led, technology enabled. So that multidisciplinary approach is critical.
Thank you so much.
Thank you.
Thank you very much.